Uh, Good morning once again, everyone. Um, I hope we're enjoying our first session with Mark on stress management. It was quite an informative section, but now we move on to the light bulb moments with the IAGs. And today we've got 5 presentations that we are going to uh, to to have from our research IAGs and also from the uh, programs IAGs on the ground. So how we are going to do this is we are going to have the first 3 presentations. They are more on the impact of GBV. Then we have the comments, we have a plenary session. Then we also do the other 2 presentations, mostly on the issue of the use of technology, particularly in these times of COVID-19, how it's impacting our day-to-day work. So to start our discussions or the presentation that we are going to have, we'll start with Lynette Kuzai-Soushe. She's a research IAC with the University of Zimbabwe, and the research is on the social cultural determinants of gender-based violence and harmful practices in Manicaland, Zimbabwe. Then we'll go to our next presentation that will be from Tendai Degezela on social and economic cost of partner violence against women on survivors, households and communities in Mashonaland West. Then we go to the third presenter, gender-based violence among post-menopausal women in Mount Darwin. That will be done by Violet Paramoto. So at this moment, I'll give the opportunity to Lynette to start sharing the light bulb moments with the topic, the social cultural determinants of gender-based violence. So Lynette, please go ahead with your presentation now. Thank you.
Thank you so much. Good morning, everyone. Thank you so much for the wonderful opportunity. So I'm going to present my research project entitled The Social Cultural Determinants of Gender-Based Violence and Harmful Practices in Manicaland, Zimbabwe. The reason what really inspired me to come up with this topic was for us to address problems, we should know their root causes. And our initiative should also be embedded on the causes that are really leading to the problem. That is why I came up with the topic, the social cultural determinants of gender-based violence and harmful practices in Manicaland. The next slide, please. So my introduction is going to include my problem and my objective. So realize that gender-based violence and harmful practices have been a cause for concern world over, as they have been emerging as a public health concern, global, and even as a sexual and reproductive health issue. We also realize that gender-based violence and harmful practices, they are symptoms of the underlying power imbalances and gender inequalities which are embedded within our societies. According to the studies that have been conducted at a global level, we realize that 35% of women are experiencing gender-based violence in the form of sexual, emotional, physical, and economic violence. And when we talk of harmful practices, at a global level, we realize that mostly we talk of child marriages and what we call female genital mutilation. However, narrowing it down to specifically suit our Zimbabwean context, we realize that yes, we are experiencing child brides or child marriages. And in terms of another practice, we have what we call female genital modification, not necessarily female genital mutilation in the form of labia elongation. And we realize that in as much as initiatives have been put in place, we also face challenges of inconsistency within our laws. Let's take, for example, the issue of child marriages and us looking on the issue of consent to marriage at age of 18 and consent to marriage at the age of, and consent, to sexual indulgence at the age of 16, and consent to access sexual and reproductive health services at the age of 12. If you look at these three laws, you realize that, let's take, for example, if a 16-year-old consent to have sex and ended up getting pregnant, she cannot get married because she is still a minor. Yet maybe the husband might be in agreement to marry her, which might at the end of the day result in it being called child marriages. So it is against this background that I end up coming up with this objective. The first one being to identify the common types of gender-based violence that are being experienced. The second one being to establish the knowledge, attitudes of people on gender-based violence and harmful practices. And the last one was to understand the social cultural determinants that are causing the gender-based violence and harmful practices to be pervasive in societies. The next slide, please. So the methodology that I used on my thesis was the first one. The methodology that I used, my target population were women within the age group 15 to 74. The reason why I chose this age group is that most of the studies that have been conducted, be it at a national, global, or a local level, they were targeting the reproductive age group, which is 15 to 49. So in my case, I wanted to understand the dynamic of these experiences between the women within the reproductive age group and those that have reached the menopausal stage, which is 50 to 74. And my study area was Mutasa in Ward 11, 14, and 17, and Boera, Ward 14. My research design, my study triangulated quantitative and qualitative methods. And under quantitative method, I used a survey which constituted of 400 sample size, 170 in Boera and 230 in Mutasa. Then under my qualitative method, I did key informants interviews, in-depth interviews, and focus group discussions. Then my ethical considerations were cleared with the Department of Population Studies at the University of Zimbabwe, Ministry of Women Affairs, then the district administrator in Mutasa and Boera, council, and the police. So my presentation is based on content analysis, taking into account that I'm still working on my thesis. Henceforth, I'm going to share with the rest I'm going to share with the document with you guys as soon as I complete, that is in September. However, the findings that I'm really going to share with you are based on content analysis. So according to the studies that have been conducted in Zimbabwe from the Zimbabwe Demographic Health Survey, ZIMSTAS 2015, it reveals that 42% of women are experiencing violence, and a major form of violence that are being experienced by women include sexual, physical, that the determinants that were really causing gender-based violence to be pervasive in societies, I have grouped them into three to say that individual, family, and community. And focusing at an individual stage, you realize that there's an issue such as age, educational level, employment status, alcohol consumption, and even anger issues. Then focusing at family level, we can talk of the history of violence, type of violence that someone is in. Then we can talk of the issue of patriarchal dominance. Then in terms of community, we can refer to the type of work and even religion, linking this to even the presentation that was done yesterday by Sharon when we're talking of gender-based violence within the public spaces. And also, one's access to information can also be a contributing factor to whether they can be perpetrators or they can choose not to indulge in these issues of violence. Then also the findings shows the issue of low reporting, especially in the rural areas, whereby we realize that in as much as these issues of gender-based violence are being reported, we tend to have underreporting in the rural areas. And also sexual and physical violence has tend to be the most
Hello, Kuzi.
Hello.
Okay, we're no longer hearing you. Please go ahead.
Okay, so I was talking of the determinants of gender-based violence and harmful practices, and I've grouped them into three to say we have the individual, family, and community. To say that at individual, we have age, education level, employment status, and even alcohol consumption and anger issues. Then at family, we have the history of violence, the type of family, and even the patriarchal dominance within a family. Then at community, we can even refer to the type of work that one does on a day-to-day basis. I can even link this to the yesterday presentation that was done by Sharon, whereby I realized that there is an increase in violence. There is violence in the public spaces, and we can even say that the type of work that those people are in on a day-to-day basis in those public spaces can even be a factor of why there is pervasive nature of gender-based violence in that area. Then also the ability to access information, correct information on gender-based violence can also be a factor that one choose not to resort to violence as a conflict resolution mechanism and opt for a violence-free environment. Then another finding that I also find interesting when I was doing my content analysis was the issue of reporting, whereby I realized that in as much as gender-based violence are being reported, it is mostly within the urban spaces, and there is low reporting in the rural areas. Next slide. So my recommendations that I came up with after the deep thinking in relation to my topic, I realized that we should adopt what we call the life cycle approach when we are addressing gender-based violence initiative. I would like to link this to the Mad South initiative of Catch Them Young, whereby we have to capacitate the young people while they are still young on the effects and the implications of gender-based violence, so that when they grow up, they tend to also be champions of gender-based violence. Then targeting the civic societies, when we are doing initiative in our communities, let's learn to integrate men and women, because most of the initiatives were really targeting the women. At the end of the day, we realized that the virtue that now the woman is more capacitated, it can also be a disadvantage to the men, that they end up causing more harm to the women because they have that information that they are very much aware about. So we should learn to integrate the men and the women when we are dealing our initiative. Also applauding for the He for She campaign. Then also linking it to our Pillar 6 of our Spotlight Initiative goal, we should integrate all institutions to combat violence. I just refer to, let's work together hand in glove, the family institution, the workplace, the church, let's work together and fight gender-based violence. Then this one, referring it to the government, there's need to realign and strengthen the laws that really combat violence, because the presence of inconsistent somehow render the women very vulnerable to the subjugation nature of gender-based violence. Then the last recommendation that I thought could really work also for the civic organization was the issue of women and men empowerment. In as much as we have been empowering the women, we have not, on the other hand, capacitating the men on how to handle an empowered women, which also was also resulting in more violence in homes. I'm drawing this conclusion from this recommendation from my fieldwork that I had for the last 3 weeks, whereby the virtue that the females now know more information, the men tends to use violence because they cannot argue on a certain level with the women. So when we empower women, let's also empower the men so that they can be at a better level and same level of understanding these gender-based violence issues. With this, I thank you.
Thank you so much, Kudzi, for that wonderful presentation. So whoever has a questions, let's just pack our questions so that we ask them at once. At this moment, I'll just give Maureen a few minutes. She's got something to say. So Maureen, please go ahead.
Thanks, Rati. It's more like a minute or less. I just wanted to acknowledge Michelle. Thank you so much for joining. Colleagues, I think as I indicated, we were going to have a colleague from HQ from New York. So we have Michelle Mendes Silva online, and thank you so much. I mean, it's like 4 in the morning on your end. So Michelle, this is the team, the Innovators Against Gender-Based Violence, the program IAGs, the admin IAGs, and the researchers who are pursuing their master's thesis. So everyone, Michelle, I think you see a name, she's listening to you all. Thanks, Michelle. All right, you can go ahead, the next one.
Okay, thanks, Maureen, for that introduction of Michelle. I hope later she'll be able to say 1 or 2 words to the rest of the team. So our next presentation is on gender-based violence against among postmenopausal women in Mandarin South. A research IAG, Violet Mparamoto. She's going to give us finer details. So please go ahead, Violet.
Okay, morning. May you kindly share my slides, please, Rati?
Okay.
Okay, good morning, everyone. I feel honored to be part of this presentation. And I'm going to be taking you through my research.
Sorry, Violet. This is the last presentation, the one that we are going to have. So let's. I think the next presenter should be Tendai. Yes.
Okay,
sorry
it's fine.
for that. Okay.
Thank you very much, Rati. Can you hear me?
Yes, we can, but speak up a bit.
All right. So my name is Tendai Kimdingizela, and I'm going to be presenting on social and economic costs of personal violence against women on survivors, households, and communities in Mashonaland West. Next slide, please. So violence against women and girls is a public health issue, as noted, but then literature have proven that its impact on economic development and societies exists and is very huge. Women have important role in construction of social and economic fabric. Yet personal violence has proven to affect negatively women in playing their roles in the construction of social and economic fabric. Recent demographic health survey statistics show that Mashonaland West is the second highest with cases of domestic violence. So with so many rising cases of domestic violence, there is limited knowledge of how much survivors, households, and communities are paying due to personal violence against women, especially in developing countries' context, considering that they are trying to build their economies. So my main objective was to explore the costs of domestic violence against women so that adequate funding and policies are put in place to minimize these costs. And specifically, I intended to find the risk factors of domestic violence. So my methodology, I was targeting at women who were aged between 18 to 60. This was because my interests were mainly on the incomes. So according to the law, the age of apprenticeship is 18 and age of retirement for women is 60 in Zimbabwe. And my study area was Karoi and Karoi Urban and Jimba Rural. These were chosen purposively because evidence from literature and facts showed that these two districts were prone to gender issues, mainly due to the patriarchal nature of the community. And also I noted that crop farming is dominated in these areas. And there's literature shows that partners who are into agriculture are more likely to be perpetrators of personal violence. The research used survey and focus group discussions. And then I went on to do the key informant interviews and in-depth interviews to validate some of the issues which were being raised during the survey. and the symbol was 180. I found that it was 177, so I approximated it to 180. And data analysis, so I used logit regression to find the risk factors, and propensity score matching was then to calculate economic cost, where loss in earnings or income was the proxy for economic costs. And to calculate cost to survivors, households, and communities, I used summary statistics, and ethical considerations were done by the University of Zimbabwe. Next slide. So I've tried to put my findings in one in this graph. So I went on to look on social impacts of partner violence on survivors, households, and communities through the in-depth interviews and focus group discussion. So I found that isolation and social stigma reduces women's social networks. So that social participation is a cost to the community, which is brought about by personal violence against women and girls. And also, I noted that it was noted that survivors of domestic violence were not associating with others. For example, during in-depth interviews, one of the participants said her husband did not like to see her with anyone else. So this is a cost to the survivor and also the community, as she's not likely to associate with others. Also, through in-depth interviews, I also observed that quality of life the survivor lives in is different from the one before marriage, and even what she expected. They are likely to have low quality of life, which is the cost to the survivor. Then I went on to find the economic costs of partner violence against women and girls. So loss in income was represented represented the cost to the economy brought about by partner violence. So I found that on average, a woman who is experiencing partner violence was earning $18 less than a woman who was not experiencing partner violence. This was mainly because if a woman's relative age or income is increased, so her bargaining power increases, and the level of domestic violence she might experience decreases, thereby improving her outside options. Then I went on to look at the risk factors, like what's really causing the partner violence in these areas. So out of 9 variables I investigated, only 4 were significant, showing that there was risk factors of partner violence. So for women's employment status, I found that financial independence of a woman increases her ability to leave abusive relationships. Then on witnessing, another variable was witnessing parental violence, where I found that children who were once exposed to parental violence experience social damage that affect their developmental growth, and effect on girls is huge, as they are high likely to become victims in their dating relationships or even marriage. Then another one were relationship level variables, which I found that partner consumption of alcohol was a risk factor of partner violence. So I've observed that alcohol allows abusive partners to justify their abusive behaviors, making women more vulnerable every time their partners drinks alcohol. Then there's also duration of marriage, where I found that young brides are prone to sexual abuse in their new homes with less friends and relatives to tend to, and they normalize it, saying, this is what it is, this is the marriage. Then I went to find the community level variable, which was area of residence, where I found that people in the rural were experiencing partner violence more than in urban. And the reasons was that rural areas are patriarchal in nature, and they support male dominance. So women, they don't have a say in anything the men says. Then I went on to look at the costs to survivors, households, and communities. For the cost to the survivors, they are displayed as average figures. So the cost to the survivor was mainly due to medical fees, displacement costs, and I also made one interesting observation that the survivors were not going to police. In rural areas, reason was mainly because of the distance to the police station, and others were not even aware of the laws against domestic violence. Most of the survivors suffered from depression, which was confirmed by the healthcare provider I interviewed during key informant interview. And most of the survivors suffer from high blood pressure, where the key health care provider indicated that most of high blood pressure patients are either old age or survivors of partner violence. So the costs were high because the high blood pressure pills, the healthcare provider indicated that these were at low stock in government hospitals and only given for free to the old age. So most survivors would end up going to the pharmacies where they are charged in US dollars. And it's a very higher price. I also went on to find the costs to the cost to the household, where were mostly due to medical fees, were mostly caught up in the fight, with most of the households being the children and relatives to the survivors. Cost to the communities was mainly by neighbors through giving survivors food, place to stay, some helping them with rent, especially in urban areas. So overall, I then calculated the economic cost due to partner violence in Mashonaland West, and I found that it was 5 million in that red box. It was 5 million US dollars, and this is per month loss. So given the current efforts of government to try and find the funds for water infrastructure projects in Mashonaland West, it is noticed that the partner violence is negatively affecting this by taking away some money which might be used to facilitate in this project. Next slide, please. Next slide. So on recommendation, firstly, there's need to put in place prevention programs rather than remedies to minimize costs, and also research should be done on cost and benefit analysis of prevention versus remedies, which may shed more light to why reacting to prevention of gender-based violence is a great necessity. According to the fourth pillar of Spotlight Initiative, high quality essential service for survivors must be made available, and service providers should be capacitated. Just like those victim-friendly units at all police stations, they should also be the section at hospitals, especially providing free or low-cost pills to the survivors. Because high blood pressure are already in short supply, and donors should help make these pills available, not only to the old age, but also to the survivors of partner violence. And also use of technology. This has proven to be an essential way of minimizing costs, and thumbs up to Mashonaland West as they have reached to many through use of digital space. So more innovation should be done using technology to eliminate gender-based violence. Like in United States, there are tower lights with alarm buttons where if you are in danger, you press and quickly the police respond. And also gunshot detections are also available. So also to eliminate gender-based violence, such technological innovations can be done to address and minimize the costs. Then on systems approach, there's need to promote systems approach to gender-based violence-related intervention. There's need for interconnections of government, private sector, and the public to end gender-based violence, and also need to call for the amendment of Domestic Violence Act. So I noticed that the Domestic Violence Act excludes certain acts of abuse, and in Mashonaland West, I noticed that emotional abuse has the highest rate, and it is excluded, yet it is excluded from the Domestic Violence Act. So there is therefore need to call for its amendment so that any kind of violence can be regarded as an offense liable to pay fine or imprisonment. And also there is need for continued support for children who witnessed parental violence through education, more campaigns at primary and secondary schools, especially under the Catch Them Young initiative. Also, lastly, there's need to build and capacitate services that treat more male problem drinkers, such as rehabilitation centers, because in Zimbabwe, these are regarded as rich people's places. So making them affordable to everyone helps to treat those with drinking problem, thereby ending who end up abusing women. Oh, I thank you.
Thank you so much, Tendai, for that wonderful presentation. It was very insightful, and we have learned a lot. So, colleagues, let's just also pack our questions, our comments, so that we take them all at once when we finish all the three that are dealing with the impact of GBV. So, at this juncture, I will now call upon Violet to give us a rundown of her presentation on gender-based violence among postmenopausal women in Mandarin South. So Violet, please go ahead now.
Okay, thank you once again. So I'm going to take you through my research topic, gender-based violence among postmenopausal women. So you realize that since 1979, since the introduction of the Convention on the Elimination of All Forms of Discrimination Against Women in 1979, which came as a response to address the inequalities that existed between men and women, 189 countries have ratified the treaty thus far, and all the subsequent policies, for instance, the United Nations General Assembly of 93, the ICPD of 1994, and the Beijing Conference of 1995, all those were policies that were trying to address the inequalities and the discrimination that women were facing. And exposed in all those policies is that no woman of any race, age, or social standing should be violated. However, reports on the ground show otherwise. According to the Women's Report of 2015, it shows that violence against postmenopausal women is not given the attention that it deserves. Through data collection, globally, most policies in most countries, they rely from data from demographic health surveys, and Zimbabwe is not spared. We also rely on data from the National Statistics data, the ZimStat, and they tend to focus on women who are still in the reproductive age groups, 15 to 49, leaving out those who are post-reproductive. Yet projections indicate that in 2050, women will comprise 54% of the global population, where we'll be having women who are age 65 and over. So this comes as a concern. If deliberate and distinct actions are not to be taken to address the needs of postmenopausal women, it will create chaos, and thus this is the clarion call to all those present, the policymakers, development practitioners, to say we need to engage postmenopausal women in the GBV discourse, because for far too long, most programs and interventions, they were hardly tailor-made to address the challenges that are being faced by this peculiar special group, postmenopausal women. So as articulated by the SDGs, that no one should be left behind, I also believe that postmenopausal women should not be left behind, and there's need to integrate them in the GBV discourse. So for my methodology, my target population were women who were aged 55 to 75 plus, the local leaders, these are the village herds, the health workers, and the victim-friendly unit officers at the Mount Darwin police station. So for my approach, I used the mixed methods approach, where I combined qualitative and quantitative methods. And I did a survey where I interviewed 145 women, and also focus group discussions, key informant interviews, and in-depth interviews. And for my sampling, I used cluster sampling for the villages and convenient and purposive sampling for the different individuals that I managed to interview. For my data analysis, I used SPSS and thematic analysis. And for my ethical considerations, I was given an approval from the University of Zimbabwe, and my study protocol was also approved by the Medical Research Council of Zimbabwe. So for my findings, my first objective was to explore the conceptualization of GBV by postmenopausal women and their awareness if they knew about gender-based violence. So 88% were aware about gender-based violence, and 60% knew about physical abuse, whilst 55% knew about sexual abuse. Those who knew about emotional abuse were 46%, and those who knew about economic abuse were 39%. So for their risk perceptions, they had a high risk perception to emotional abuse, and a low risk perception to physical abuse, and no risk at all for sexual abuse. So when asked about their sources of information regarding GBV, 76% highlighted that they solely got information from the radio, and 33% from church, and the other smaller percentages from NGOs and other sources of information So for my results, the demographic and socioeconomic characteristics of the respondents were as follows. 45% had never been to school. They could not read, they could not write because of the nature of the environment that I was working with. Most girls don't go to school, thus impacting their later life. 48% were married or in unions, and 72% were in monogamous unions. 87% were Christians, and 84% relied on farming and others from mining activities from a popular place that they call Mukaradzi, where they go and get gold. So 84% reported that they'd been emotionally abused, 55% had been physically abused, and 41% had been sexually abused. And for those who had been sexually abused, they were mostly abused using vaginal sex and anal sex, and none agreed to oral sex. Sorry, may you kindly go back to the other slide, the last slide? Okay, and for the perpetrators of GBV, the people were known to survivors. These are the spouses, the boyfriends, and relatives were the perpetrators of gender-based violence. However, reporting was low due to various reasons: fear of retaliation, divorce, because of age. Next slide, please. So for the underlying factors, I've just highlighted some of the underlying factors, but these are not all. Infidelity, male dominance, cultural practices, low education, alcohol abuse, low status of women, legitimacy of lobola, and lack of libido. So you realize that menopause comes with its challenges. When women become menopausal or postmenopausal, they have problems when it comes to having sex. So usually they won't be interested in having sexual activities. So the husbands end up forcing themselves on them. And there's also a myth that exists among the kore that if you continuously have sex when you're postmenopausal, you then develop a bulging tummy that will then explode once you die. So because they want to avoid this bulging tummy, they don't want to engage in sexual activities. Then this creates tension between the husband and the man. Then they end up being sexually coerced. So for the health impacts of the different forms of gender-based violence, low self-esteem, suicidal ideation, anger, chronic pain, hypertension, and teeth that fell off because of physical abuse, and emotional distress, STIs, and HIV were some of the health impacts that the respondents reported as being results of GBV. So in conclusion, the study realized that postmenopausal years were aware of gender-based violence, and emotional abuse was the most reported form of gender-based violence. And as I highlighted earlier, male dominance and intimate partner infidelity, alcohol abuse, I guess all the underlying factors can be encapsulated in cultural norms and values. Then postmenopausal women indicated that they do not report abuse for various reasons, like I highlighted fear of divorce, retaliation, fear for children, and fear of not wanting to embarrass families. So the study also highlighted that GBV is debilitating health consequences on postmenopausal women from emotional distress, physical injuries, and STIs and HIV. Last slide, please. So for my recommendations, the first one is the state has the primary responsibility of ending gender-based violence. Therefore, there's need for strengthening postmenopausal women access to information through licensing of community radios. Because as was highlighted, they rely on the radio because they cannot read, so they don't need papers. So there's need for community radios to inform these women on issues on gender-based violence. There's also need for traditional courts to be capacitated, because for the rural women, these are the first court of, if not the last court of appeal for many in the rural communities. Thus, capacitating these institutions through training will assist in empowering communities in search for justice and towards transformed norms and values around gender relations and masculinity towards ending gender-based violence. Then there's also need for training and sensitization of religious leaders on gender-based violence issues, which will cascade down to congregates through seminars and engagement meetings. There's also need to promote girls to be in school, because promoting prevention of GBV early in life is very essential. So girls need to be empowered. They need to be in school and avoid early marriages, because I realized as I was doing my research that most girls drop out of school and get married very early, and this will obviously impact later on in life. Then there's also need to promote and protect postmenopausal women's rights to have control over sexual matters through SRI-HR service provisions and improving response services for survivors. Postmenopausal women should have access to a clear referral and reporting structure, which is victim-friendly, and from the traditional systems through awareness campaigns. And lastly, community-based dialogue groups between postmenopausal women and survivors of gender-based violence and local leadership on GBV prevention strategies. I thank you.
Thank you so much, Violet, for that great presentation. And that was the last presentation on the social and economic cost of gender-based violence. So thank you so much, ladies. You were very much on fire, Lynette, Tendai, and Violet. So at this point, from the colleagues, you've been jotting down your questions, your comments. So for the next maybe 20 minutes, I'll give you this opportunity to now be asking your questions, and the three presenters will be available to answer our questions or any comments that we have for them. So yes, I've seen Moline, please go ahead.
Thanks a lot, Rati. And mine is not so much a question, but thank you so much to the presenters. Really, really well done. And again, to acknowledge, I think I welcomed Michelle already, and I see Evelyn from Esaro from the regional office is also online, and Rubin Bomshavi from our resident coordinator's office. So guys, we've got some guests in-house, but that's all I wanted to say. I don't have any questions per se. I'll leave the floor to others. Thanks. Over.
Okay, thank you, Moline. I recognize Kudzi. Please go ahead, Kudzi, with your question or comments.
Oh, okay. I want to thank the ladies for such wonderful presentations and findings on the social, on Lynette, who presented on the social cultural determinants of GBV and HP. I also want to the recommendations to say men must be taken as partners, not perpetrators in fighting GBV, because the more they are viewed as perpetrators, because most times when civil society is when civil societies come into the communities, they sort of give women the upper hand and leave men behind. And the more we do that, men becomes more defensive, and they will not accept fighting GBV, because I've seen that in most cases men have this perceived over-empowering. They say women are being over-empowered, and that becomes a main cause of concern when they feel, or when they think that women are being over-empowered. So I think we must push that men be taken as partners. As we go into the community, we must involve as many men as we can. Also on your statistics, I don't know if you can find current statistics. You gave statistics on 2015, 42% of women experiencing GBV. Maybe we should also look into finding current statistics like those within 2019 or 2018 to 2020, so that we will see the change from those some older statistics there. So thank you. And Violet, yours is a very interesting presentation on GBV and on menopausal women. Thank you so much.
Thank you so much, Kudzi, for those comments. Lynette, do you have anything to respond to or for Kudzi's comments? Are you online, Lynette?
Hi, I'm online. My network has disconnected, so I didn't hear this question and comment.
Okay, she was asking about having current statistics. She said your statistics is from 2015. She was maybe also recommending if you can also find current statistics.
Okay, fine. Thank you so much, Kuzu, for the amazing question. Indeed, current statistics are there. However, that is why I said when I was reviewing, I was focusing on content analysis, and mostly ZDHS has been the mirror that we have been really working with. However, when I'm going to do my discussion part, I'm really going to include all these current statistics. That is why I say that I'm going to share with you as soon as I'll be done.
Okay, thank you so much, Lynette, for that response. Blessing, please go ahead with your comments.
Okay, thank you, Rati. I want to thank the ladies for some brilliant presentations. Quite a few questions. The first one being on the first presentation by Lynette on female genital modification, which she has mentioned as one of the harmful practices that in TASA. It's quite a
Hi, Blessing.
Controversial issue, the female genital modification, especially the labia elongation, but some of the women arguing that there is no harm in the modification. Hello?
Yes, you are a bit breaking, but I think we have. Yes, Blessing, you are a bit breaking, but I think we have grasped your question. I think Lynette will be able to respond on it. Lynette, did you hear Blessing's question?
Yes, I did.
Okay, can I proceed with the other question?
Okay, go ahead, Blessing.
All right. So that was for Lynette to try and explain to us how labia elongation is harmful. The next question is on Tendai's presentation. I need some clarification on the costs that she was mentioning. She was mentioning some figures like $18.17, which I think I missed some clarifications on how what are those costs? Is it $18 per day? Is it $18 per month? Is it per moment of abuse?
Zano?
I need some clarification. I think I missed some important information on that. Violet is just quite a comment in which I also was speaking of the many postmenopausal women. They rely much on the radio.
Yes, Zano, we can hear you now.
Yes, so I'm saying it is just it was just a recommendation to say I have noted from her presentation that postmenopausal women are relying much on radio and churches, of which churches that was about 33%, and looking at the situation that we are in currently, the lockdown, churches are now are not in full operation because of the pandemic. As a recommendation, probably would consider putting more effort in utilizing radio stations that we might have in our localities. Thank you so much for the opportunity. Thank you.
Thank you so much, Zano, for that question. So, ladies, please go ahead and just respond to the female genital elongation. Zano is saying there's no harm. What do you say on that, for Lynette? Then also clarification on the cost of GBV for Tendai.
Okay, thank you so much, Rati, and thank you so much, Blessing, for that wonderful question. So we realize that there is what we call a literature gap, especially on this issue of labial elongation, and that is why even my research is targeting to really understand, is it a violation or not? However, from the studies that have been conducted that are there currently in Zimbabwe, we realize that the time in which this practice is conducted, mostly it is within the age group 9 years to 13. It is a period whereby a child will not be in a position to make informed choices for herself. At the end of the day, realize that we do not have a specific length of these labias. How long should they be? Which results in, at the age of 30, 40, 50, thereabout, they started producing smelly water that comes out of them, which is another sexual and reproductive health consequence. So my research, that is why in as much as most women were saying that it is of no harm, but the age in which this practice is initially commenced, it's a period whereby children won't be aware of what exactly is happening. At the same time, some women, they use herbs that can even have a painful impact on the child. So it's a matter of even me as an individual, I am also going deeper to understand, is it harmful or it is not? Although most women, they say that it is not harmful. But I am really going to work on understanding why do some people call it violation, or maybe it is a feminist point of view. I hope I answered your Blessing.
Okay, thank you so much, Lynette, for that. Then Then Tendai, clarify on the costs.
Okay, thank you so much, Rati, and thank you, Zano, for the question. So for me, my question was, if I heard your question well, you were asking the economic cost of, to say that, is it a figure per month or what? So $18.71 is a figure per month. Is an average figure. So to make it more easier for you to understand, I'll say the interpretation is that on average, every woman who's experiencing personal violence is earning 18.71 cents US dollars less than a woman who's not experiencing personal violence every month. So this is an average figure every month. An observation I found out. So it is an economic cost. So for all the other figures you are seeing there, they are monthly figures. They are monthly costs. So every month, I'm saying Mashonaland West is losing 5 million US dollars to personal violence. I hope I answered you well.
Okay, thank you so much, Tendai, for that response. Let me just go to my chat. I have a question for you guys, the panelists, from Michelle. The first question is, if the panelists have felt the impact of COVID-19 on their findings, if they believe COVID-19 has changed some of the trends, if they worsened or kept at the same level. And the other question is, what would be the role of the private sector in addressing those findings? In addressing social cultural determinants of GBV and harmful practices, on addressing the socio-economic cost of GBV, and on addressing GBV against postmenopausal women. So let me take it again. If the panelists have felt the impact of COVID-19 on their findings, if they believe COVID-19 has changed some of the trends, has it worsened or kept at the same level, what will be the role of the private sector in addressing those findings? In addressing social cultural determinants of GBV and harmful practices, on addressing the social economic cost of GBV, and on addressing GBV against postmenopausal women. So Tendai and Lynette, please kindly answer these questions from Michelle. Thank you.
Thank you so much, Rati, and thank you so much, Michelle, for the amazing questions. The first thing is that indeed COVID-19 has really impacted on us, and even the data that you have been collecting, taking into account that the statistics before the lockdown, the COVID-19 and during this pandemic have, the statistics itself has increased. However, the time that we were supposed to go to collect our data was during the period, high peak of the COVID-19. And we realized that the virtue that gender-based violence has increased, at the same time, due to the lockdown restrictions, the perpetrators and the victims are within the same household, which was, to my side, especially since I was focusing on the social cultural determinants, I realized that it was a challenge whereby people were not opening up. The moment she's then talking to me, she goes back home and she gets again, she is being violated more for opening up. At the end of the day, she doesn't have anywhere else to go to seek services. So I realized that in terms of my collecting data itself, it has really impacted. And in terms of statistics, they have really increased from the period before the lockdown and after and during the lockdown period. Then in terms of what role can the private sector to deal with the social cultural determinants, I think it's high time where by now the private sector has to go into these societies, capacitate both the males and the female. Because the moment we go and take only the victims and capacitate them, we are leaving the perpetrators behind. Let us integrate both of them under one workshop, let us capacitate them. At least when they go back home, they will start on a page which is the same. So there's need of the private sector to really capacitate both men and the women, especially in this COVID-19 period whereby they cannot run away from it, but they have to stay with the perpetrators within the same household. That is what I got from my fieldwork observation.
Okay, thank you so much, Lynette, for that response. Violet, please go ahead if you've got any comments.
Okay. Well, on my part, I did my research before the COVID-19 pandemic hardly hit Zimbabwe. So I wouldn't know now if the cases have gone up when it comes to postmenopausal women. However, organizations in Zimbabwe like Musasa Project indicate that they are now having more reports in line with gender-based violence. So I guess because now the survivors are staying with the perpetrators, like highlighted by Lynette, so I guess the numbers have gone up. And on the issues of the private sector, I believe that there is need for the private sector to be part of the solution to the problems that are being faced by postmenopausal women. As I indicated, there is need for partnership between government and the private sector to address such challenges. And I'll also stamp on this that women who are postmenopausal are also experiencing gender-based violence, and private sector has to engage these women to amplify their voices. Thank you.
Thank you so much, Violet, for that response. And Tendai, do you have anything to say?
Yeah, on COVID-19, I think it has affected so many people. Like we have noticed that many people are being laid off at work, meaning that now the perpetrators are staying with their wives, and the homes are no longer safe; they are war zones. So, and also I have made a follow-up by the Musasa Project and realized that the cases of domestic violence have been rising. But an interesting case is that for the police, the cases, like, people are not reporting. So it means it would mean something. And also on the private sector, so the private sector is being affected by the costs, because we're saying that women are losing earnings, and these earnings are supposed to be used in private sector to build up their companies and all. So measures should be, private sector should work together with the government to minimize costs. This can be done by them doing counseling sessions at work, and even helping the survivors, because they would see that the person is not well, there is the efforts she used to work hard, and now she looks like she's being affected a lot by a lot of things, because most of the survivors, they don't come out. So private sector should make efforts at their workplace on how they can address these issues, like providing counseling sessions, and also work together with the government so that the costs are minimized. Thank you.
Thank you so much, Tendai, for that update. I think due to the time, I'll just take Sekai and Kudzi. Then we wrap up so that we have the other two remaining presentations. So please go ahead, Sekai.
Thank you so much. I very much appreciate the research that was done by Violet. I think the issue of menopausal women has been ignored for a long time. But in Mbire, we also have such cases, and the men were very much unhappy. They were saying that from the age of 55 upwards, actually the women, they desert the bedrooms and go to sleep in kitchens. So they wanted this resolved. So I thought that maybe it's not only the women who are being violated against, but also the men, because they also have conjugal rights. What is it then that we can do to make sure that both the male and the female needs are met in such a scenario? Okay, thank you so much.
Quite interesting, Sekai there. Yeah, the women are now deserting the men. So, Violet, did you have anything in that line, or anyone from who can be able to answer on this one? Not Violet only, but I think anyone can answer this.
Okay, maybe before another person responds, may I respond, Rati?
Yes, go ahead.
Okay, as I was doing my research, I realized that when women reach menopause, because they do not have the proper, maybe they don't have the lubrication to help them when they are having sex, because we have to note that when women reach menopause, their vaginas, they atrophy, like the muscle parts, it thins, so sex becomes painful. So for women, it's no longer pleasurable, so they end up deserting their bedrooms, yes, and they also highlighted that they do that because it's painful. And as I was interviewing other women, they also reported that it's better for men to go out, look for other younger women. So you see that in this particular ward, most men are in polygamous marriages. They have younger women because of that issue of vaginal atrophy because of menopause. So I guess there is need for organizations that work around SRHR issues to be engaged in such communities so that they address problems that menopausal women are facing, because they don't have the proper lubricants to use. So there's need for organizations to come in and maybe provide services in line with those challenges.
Okay, thank you so much, Violet, for that response. It's now getting very interesting. But Sekai, do you have anything to say before we end this session? I can see your hand is up.
No, I think it's the previous one. I'm trying to remove it, but I'm failing.
Okay, that's
Rati,
okay.
can I come in?
Yes, Maureen, go ahead.
Thanks a lot. And I think part of the response to that question on men leaving, on women leaving their husbands, I think Violet Rufara articulated it quite well. It probably requires more SRHR interventions in the communities, which is something maybe with the Spotlight or the other programs the CSOs can look into. As we move forward, can I ask that when the presenters present, when the questions come in, if they can be concise and really short so that we minimize the amount of time the going back and forth, and also give a chance to others that may want to come in. And this is bearing in mind that our guests, I see Michelle has already asked, that Evelyn also or Wimbo might want to ask questions. So maybe the comments next time may be a bit more concise. But this was very interesting and very interesting stuff that we have learned. So over to you, Rati.
Thank you so much, Maureen, for that. Yeah, just let's be short and precise for real. So I can now safely call upon the next presenters on the role of the digital technology on eval. So my next presenter is Blessing Chiwara, taking a stand against GBV WhatsApp group initiative for March West. It's a campaign that they are having. So Blessing, please go ahead.
Okay, thank you, Rati. Hi, everyone. I'm Blessing Chwara. representing Innovators Against Gender-Based Violence in Mashonaland West under Caritas Chinhoy. We are presenting on utilizing the digital space to take a stand against gender-based violence in Zimbabwe. You can move on, Rati. Thank you. The next page. The problem we are addressing, 66% of women in a study conducted by UN Women and Partners in Zimbabwe reported that GBV has increased in their communities during this COVID-19 era. The lockdown restrictions has hindered GBV programming, exposing women and girls to violence and vulnerability as they spend more time with perpetrators. It is unfortunate homes have become hubs of violence and vulnerability rather than havens for many women and girls. And according to the Women's Coalition of Zimbabwe 2020, cases of GBV have increased during the COVID-19, with the Zimbabwe Republic Police Victim-Friendly Unit receiving 340 cases, GBV one-stop centers receiving 241 cases, and Musasa and agents are receiving 953 cases. All these statistics call for innovative programming solutions that seeks to capacitate women and girls with knowledge of GBV, where they can access services and how they can access these GBV services in this COVID-19 era. And in this regard, we need to come up with more robust and all-inclusive systems that helps to end violence against women and girls. You can move on, Rach. Our solution to the problem, seeing the need to continue shining a spotlight on ending violence against women and girls, and to build a strong women's movement, we resolved to adopting a digital GBV programming tool. And we initiated a WhatsApp group with the name Taking a Stand Against Gender-Based Violence. The platform brings women and men together, sharing their experiences, stories, accessing referrals, and learn more about GBV during this COVID-19 pandemic. The WhatsApp platform helped in raising GBV awareness and amplifying the voices of women and girls during COVID-19, and even in the post-COVID-19 era, if well adopted. We are also pursuing to introduce the use of the USSD and the chatbot. USSD is unstructured supplementary service data to complement the WhatsApp initiative. This will help curb problems associated with poor connections, high data costs incurred by the participants, and cater for the rural folk, considering most of our rural folk, they don't own smartphones. They have small phones that are not compatible with WhatsApp. So we're trying to provide a solution for this. The results so far, there is an increase in the volumes of participants. We are reaching at least 195 participants directly. 190 of these are active participants, and each of these active participants shares with an average of 5 people who are not in the group. This gives us 950 participants reached indirectly, and to give a total of 1,145 participants per session. We normally conduct 3 sessions per week, Mondays, Wednesdays, and Fridays. There is also an average of 3 people per week who access referrals through this platform. There is also an increase in the number of women and girls testifying to be more empowered to speak out for themselves and others who might need help. The digital platform has been appreciated and adopted by our CBOs, which is an achievement in terms of sustainability of the initiative. The Ministry of Women Affairs and the Police Victim Friendly Unit in Mashonaland West have also confirmed a 5.3% increase in reported cases and increased the numbers of women and girls seeking counseling services, albeit the COVID-19 movement restrictions. Thank you so much. This is what I have for the meantime. Maybe I will open up for the following presenter.
Okay, thank you so much, Blessing, for that presentation. So we'll just go to the next presentation, which is more or less the same. Then I understand Tracy is the one presenting for the group, Embracing Digital Platforms for Action Towards Ending Violence and Harmful Practices. So Tracy, please kindly go ahead.
Thank you. Good morning, everyone. I'm going to be presenting on the WhatsApp group initiative that is that we replicated from Mashonaland Central. So we can go on to the first slide. The problem that we are addressing, we realize that sexual gender-based violence and other harmful practices have remained a development challenge globally and in Zimbabwe as a whole, and particularly in Bire district, in Mashonaland Central districts where we are operating. Statistically, more than 75% cases of SGBV and harmful practices have been witnessed. However, with the COVID-19 induced lockdown and restricted movement, violence against women has been on the rise, and the worrying trend being that cases have not yet been reported so far to assist survivors. So from the data and the research findings that we collected from related partners such as ActionAid, these are partners that are specifically working in Mashonaland Central, we realized that so from our partners, ActionAid, ZAPSO, Ministry of Women Affairs, and the ZRP, we collected data that kind of aligned or then showed us that there are these cases of sexual gender-based violence that are on the rise within our district. We can go on to next slide. So our solution was the introduction, or actually the replication of the Taking a Stand Against Gender-Based Violence WhatsApp group, which was initially implemented by Mashonaland Central. So the idea was aimed at fostering concerted efforts and rapid responses to cases during the COVID-19 induced lockdown. So because there was so much restrictions on lockdown brought about by the lockdown, and there were not any, there was no way that people could then access certain services, we decided that a virtual movement would, in a way, enable women to speak out against GBV, which would enable organizations, community-based organizations working within the districts that we're operating in, to come together and join forces in combating gender-based violence. So through the various participants who helm from different backgrounds, that is, we have academics, we have religious and opinion-forming leaders, we have government structures within the group that we created. They all come together and address issues of gender-based violence. So basically how the platform works is that it's open-ended. It's sort of open, where people can just come in and they discuss issues. We share videos, we share stories of cases that are happening within within the province, and then people can sort of come in and mobilize resources on how best we can address the issues that are coming in. So moving forward, we intend to move beyond the WhatsApp group into having probably bulk SMSs and email campaigns to reach out to more people, as well as engaging innovative ways like animations in creating more informative messages. And then also our big idea was we have a billboard, a billboard. It's a big screen in Bire where we intend on broadcasting some of the issues that are going to be coming up as we interact with people in the communities, or as the issues come up in our WhatsApp group. Our niche as the group is that we deal with the issues. It goes beyond us coming together and discussing the issues, but we offer practical solutions. Where if someone brings up a case of, for example, there's a case of a woman who has her 7 kids and she has abandoned them, and we need to mobilize resources and mobilize different sectors to come together and help them. So we'd have the Ministry of Social Welfare, would have the Ministry of Women Affairs, would have other organizations coming in and helping us. So we offer that practical solution where we actually go beyond the virtual to doing something practical. Next slide. That would be the results, yes. Okay, so to date, I think I've mentioned some of the things. The group has a membership of 110 people, and so far we have made 8 referrals. Those are the practical things that I was talking about, where an issue is raised and then we take action. So through the referrals that we've done, we've mobilized medical assistance to one sexual gender-based violence survivor who had an attempt on her life by her husband, who later committed suicide. We've also managed to mobilize financial and resource assistance to 7 children that were abandoned by their mother. 2 of the twins who are a year and 6 months old have since been adopted by one of our partners. They've actually been taken in by foster mothers as a way of helping the family through this tough time. And then we've also had, through engagements in the group, we have realized the need to engage religious institutions, as they can either perpetuate or shun gender-based violence. So together with the Taking a Stand Against Gender-Based Violence campaign, we have sort of roped in a new twist to the campaign, where we have a religious component of engaging the Muslim, the traditional, the Protestant churches, and addressing gender-based violence, which has sort of been normalized. So we have trained our structures within the communities, our gender-based violence champions, our gender champions within our communities to hold sessions within their churches on sexual gender-based violence. But this is mostly for women, and then later on we hope that we would then, as the sessions just happen on their own, would then incorporate men into the sessions. And then the broadcast that I mentioned, we have been given permission to broadcast on, it's a giant screen that we have in Bire district, and we intend to share videos, documentaries, and informative dialogues on topical gender-based violence issues. That's it. Thank you.
Thank you so much, Tracy, for that insightful presentation. That was the role of digital technology in EVAL. That was done by Tracy, and also Blessing. And with this COVID pandemic, we see ourselves With this COVID pandemic, I think this is the in thing. This is where we are really like going, and it's very good to see that Marsh West, Marsh Central is replicated what Marsh West started. So it's really something that is good to see that the IAGs are learning from each other. So at this time, I'll open up for the next 10 minutes so that we can give our comments, our contributions to the presentation. Yes, Toilet, you can go ahead.
Okay, thank you very much for the good presentations by both Marsh West and Marsh Central. My question is targeted at Blessing. Can you please kindly shed more light on how the USSD2 works? Because, for instance, in Marsh Central, we've got some words that do not have access to network, of which most of the people there they also do not have these smartphones. And from the way you presented, I think it's a tool that enables us to close a part of this gap. So maybe if you can share more light on how it works, as well as the resources implications of using that tool. Thank you.
Thank you, Toilet, for that question. And a Blessing, briefly, just comment so that the presenters can answer at one go.
Okay. Thank you for the question, Toilet. Like I mentioned earlier, the USSD, we are using it as a complementary service that will cater for those who does not own smartphones. It works on all phones, regardless of the size of the phone, be it a Chimbuzi or the smartphone. So it is easy to use and highly cost effective to implement and run. It may be also a tool maybe to use on mapping and also to increase maybe the coverage, since we are operating in some of the rural districts which we have connection problems and other stuff. So it's maybe a way of addressing those challenges. That's what we are proposing. It's not yet implemented, but we are proposing to complement the WhatsApp group with that USSD as a problems. Thank you.
Okay, thank you so much, a Blessing, for that response. Toilet, you answered, or you really wanted the specifics of how to go about it? Okay, Zano, you can go ahead with your comment.
Okay, just
Zano, your network is a bit
on the
bad.
statistics shared by Blessing, GBV, one stop. Let me try to type.
Okay. Please type. Zano, you can as well type. Your network is bad. Type, we can read it.
Okay,
then we can read your comment. Nobuhle, please go ahead. Toilet, please go on mute.
I think Rati is the host, or Simba, you can mute all other people, and then only the person that will be speaking can come online.
Thanks, Marlene. Nobuhle, please go ahead.
Thank you, Rati. I'd like to comment on the initiative that Blessing has just indicated on the USSD I think it's really a noble initiative, which as Manicaland would also want to replicate if they successfully initiated, because the network problem is really a big challenge. And if you think of programming in areas like Chipinge, where network problems are high, you would wonder how you can go about it. But I think for the USSD initiative that he has just highlighted, I think it would be a great way to go. Thank you.
Thank you so much, Noble Shem. Yeah, Blessing, I think the team really wants your help on this. So maybe we organize something, then you really explain to the other team members how the USSD works, where there is no good internet connectivity, so that we try as much as possible to reach as many people as we can. Sano, you can just type in so that we can read your comments. Just throwing to you guys, how do you see us doing our programming in the next coming years? Maybe learning from this COVID pandemic, how do you see the role of the digital technology in movement building? Yes, Kudzi, go ahead.
Oh, okay. I just think that as we're moving on, embracing the new normal, I think digital technology is going to make a huge impact as we also embrace things like using radio, television, bulk SMSs, and all those things, because for now we cannot engage or we cannot go down to the community, but the rural communities that we work in, radio also plays a pivotal role. In some areas, WhatsApp may not be compatible because of network and the lack of gadgets, but radio and also play a pivotal role. Thank you.
Okay, thanks, Kudzi. Please go ahead, Kunenya Sham.
Okay, thank you, Rat. My thinking is in Zimbabwe, we still have to do a lot, considering that one, some areas have poor network coverage, two, actually some people do not have the gadgets. So in terms of digital mobilization of people, maybe if Marsh West are to implement the USSD initiative, we could go a long way in reaching out to many people. Thank you.
Thank you so much, Kunenyasha. Toilet, please go ahead.
Okay, I think it's an area that we should invest more on, because it is now the new normal going forward. If we do not embrace, if we fail to embrace digital technologies, then the space for us will continue to shrink. And I think as a platform, we should continuously share some of these innovations on digital technologies that are emerging or that we are aware of, like the USSD that Blessing talked about. For some of us, it was actually my first time to be aware of it. So please, guys, let's continue to share some of these innovations going forward, because it is the new thing. Thank you.
Thank you, Toilet. Indeed, let's continue working together as a team. Let me just go to the chat. There's a chat from Donald. Blessings concept is wow. As much South would love to know more about the initiative such that we might replicate it. Then from Zano, Blessing presentation statistics on VFU one-stop center. Are they are they at district level or provincial? At what point during lockdown were they recorded? Are they district statistics or provincial? So yeah, just then Evelyn, thank you for the innovative proposals and ideas. I especially appreciate the USSD idea as well. Would like to receive the presentation of this and even work towards replicating to other countries in SRO as best practices. Please share on email so we can share widely. Give credit to the innovators. Bye for now. Thank you so much, Evelyn, for that comment. I would like to ask the presenter, I think it's Tracy or Blessing, to answer on Zano's comment. Then we wrap it up. Thank you.
Okay, maybe answering to Sano's question. Thank you, Sano, for the question. It's provincial statistics, Marsh West. Thank you. I don't know if you may need further clarity.
Oh, okay.
Yes, I was saying at what point during lockdown were they recorded?
Okay, these are recent statistics which we obtained late July.
Okay. Thanks, Blessing. Dexter, then we wrap it up. Kunenyasha, is that an old hand or it's a new hand?
Sorry, it's an old end.
Okay, go ahead, Dexter, then we wrap it up.
Thank you, Rati. Good afternoon, everyone. Thanks, guys, for a wonderful presentation, Marsh West. I just wanted to add on the USSD that was asked by Toilet. It's a platform like whereby they put codes in those small phones. Then they can access information by punching those symbol codes, like the way we request our balances on our phones. Then it will information. Suppose you want to know about GBV or sexual abuse, emotional abuse, punch a certain code. Then instantly it will produce the whole information that was encoded in that phone containing the request that you have made. I thank you. Over to you, Rati.
Thank you so much, Dexter, for clarifying that. Hopefully, it will be able to assist the other IAGs from all the other provinces. And I think this is a very interesting topic, which I think Simba and the team will really sit down and see how best you can go ahead with this very innovative idea. So yes, I can see, I can just go to the chat again. Then there's Tinashe. My question goes to Blessing. How open is your group and also how are you ensuring that survivors are able to share their experiences in time? Yeah, and also from Donald, I think the digital platforms have actually yielded so much results across the globe. The hashtag Black Lives Matter, etc. However, there is need to adopt initiatives to engage the rural populace where these programs are implemented. So yeah, thank you so much, Donald and Tinashe, for those comments. So briefly, Blessing, just reply on Tinashe, then I'll ask Molin to conclude.
Okay, thank you, Tinashe, for the question. Our group is open from 9 a.m. on Mondays, Wednesday and Friday, 9 a.m. to 5 p.m. We allow open discussions during this time. Then we also give a platform for those who encounters problems during maybe off hours. We allow them to text it to our admins whenever they have a problem, so that we can maybe save them. Even when the group is closed, we allow them to share any problem they encounter during the closure of the group. So it's open. Thank you.
Moline, please go ahead.
All right, thanks a lot, Rati, and thank you so much to all the participants today and the guests that joined us. I mean, today was really, really animated, and the innovations that are coming up. And I mean, true to your name, is Innovators Against Gender-Based Violence. This is really good. The USSD, very exciting, and as you just heard, the regional office is already interested in that. To replicate that to other countries. So we'll definitely be talking to the Marsh West colleagues to get more information on this and see how best we can actually profile and document this as it goes on and how it actually helps and reaches out to a lot of people where network is still a bit of a challenge, and also in places where people don't have smartphones. So I just want to say thank you so much, and you guys rock really, really great. I think that's all from me, Rati. Over to you in Simba.
Okay, thank you so much, Moline, for those kind words. Thank you so much, all the participants today, and also the presenters. It was really a light bulb moment. I really enjoyed each and every moment. The participation was great. The contribution was great. Everything was great about today's interactions. So hopefully tomorrow it will be the same time interacting again. So I'll give this time back to Simba for any logistical issues. Thank you so much.
Thanks, Rati. Thanks, Moline. Thanks to all our participants, our presenters, and also to Mark for taking us through the stress management presentation. Colleagues, the meeting is officially adjourned, so we meet again tomorrow.